Hello, my name is Regiane. I talk about endometriosis. What is endometriosis? Endometriosis is defined as the presence of the endometrial tissue outside the uterine cavity. The endometrium is a mucosa that covers the inner of the uterus, becoming thick so that fertilized egg can be implanted into it. Whenever fertilization does not happen, much of the encarcerate endometrium is eliminated during menstruation. However, in some cases, states of begin expelling parts of this blood moves in the opposite direction and spreads in the abdominal cavity and in the ovaries, where they proliferate again and bleeds, and the endometriotic lesion occurs in cancer stroke in the ovaries, intestines, ligaments, peritoneum, in the adrenal bladder, lung, head, and others. Diagnosis is made through the existence of signs of disease, and we believe that the best marker for endometriosis is clinical dysmenorrhea. The pains may be asymptomatic or present with manifestations such as severe colic, chronic pelvic pain, deep dyspareunia, chronic fatigue, premature or urinary evacuation signs, and infertility. Diagnosis is made by physical examination, laboratory tests CA125, and male imaging test, male pelvic resonance. In this imaging, we can see force of the endometriosis in the vagina. Main symptoms: menstrual cramps, usually very strong. Pain during intercourse when the penis touches the end of the vagina. Intestinal disorders, diarrhea, constipation, and especially infertility. Discovery of the pathology because I relieved, but along with explanation of the reason for the pain, comes the news of the non-malignity of disease. Classification. The American Society for Reproductive Medicine is the most commonly used classification characterized by the size, appearance, and depth of implants present in the ovaries and peritoneum. Stage 1 or minimal disease. Endometriotic force isolate and which significant adhesions. Stage 2 or medium. Free and dispersed lesion occur with no significant adhesion, superficial implants. Stage 3 or moderate. It contains several implants. Superficial and deep with perivorian and peritopial adhesion that can be evident. And stage 4 or severe, deep. There are many superficial and deep implants with the occurrence of these membranes and adhesions and existence of long endometriomas. It is this imagine we can see forces of endometriosis in stage 4. Anatomical locations. Endometriotic lesions can occur in two forms, internal and external. The internal is when it occurs inside the uterus but is present in the muscular tissue of this organ, adenomyosis or uterine endometriosis. The external or extrauterine is with and it occurs outside the uterus. The most common sites of extrauterine endometriosis are vaginal septum, tissue between the vagina and rectum, pouch of Douglas behind the uterus, ovaries, uterine tubes, rectal surface, bladder, ligaments of the uterus and wall of the pelvis. Etiology. The etiology of endometriosis is anal. Several theories involving anatomical factors, immune, hormonal, and genetic have been predicted. The endometriosis represents a gynecological condition affecting 5 to 10% of women of reproductive age. The peak incidence is between 13 and 45 years of age. Studies show that white women and the high social class have higher frequency of endometriosis. The result may be related to a bit of greater perception of symptomology and aids to diagnosis of the pathology that these patients may have. Treatments. There is no ideal treatment for all patients and management depends on the symptoms, age and reproduction desire in the future and the short and long term. The goal of treatments is to ameliorate endometriotic lesions, decrease pain and other things, and improve the quality of life of women affected. We can have clinical, pharmacological, and surgical treatments. Clinical treatments recommended for symptomatic pains. You have no desire to have children and choose not to have pain after surgical treatments. It consists of preventing the reduction of pain caused by endometriosis, drug the prescription of non-hormonal and inflammatory drugs, analgesics, and some complete treatments like acupuncture, physical exercise, among others. Pharmacological treatment. It consists of the use of non-steroidal anti-inflammatory drugs and to a daily oral contraceptive. Surgical treatment. It consists of methods of less complex, such as release of villous adenosine, cauterization of superficial force, with complication interventions in the ovaries, bladder, intestine, uterus, and pouch of Douglas. Surgery is our alternative for women who have abundant pain that does not reduce with hormonal treatments or who intend to become pregnant soon on the future. There are cases where the condition is so severe that there is a need to perform a total hysterectomy. Our study consists of studying the effects of a specific diet with specific physical exercise to reducing the symptoms in patients with severe or deep endometriosis, providing a better quality of life. methods and matter. Sample 13 women, 32 for 14, 5 years old, symptomatic, having endometriosis. Method: microbiota analysis, resonance before and after 6 months of treatments. Procedure rates: specific diets along with specific exercise, which are begin analysis and the moments. Endometriosis is considered an enigmatic pathology which desires attention of health professionals now, as well as of the population. Since it is a difficult diagnostic disease, cure and have not been considered malignation, it causes serious damage to a woman's life. References. Thank you.